My name is Dr. Patricio Millar from NYU School of Medicine, and in my presentation today, I will talk about dizziness in Parkinson's disease and what can we do about it. I don't have any conflicts to report, but in this presentation, I'll mention medications, but by the time of this presentation, may be off-label. So there are many causes of dizziness in people with PD, but today we'll be talking about neurogenic orthostatic hypertension, that is sustained low blood pressure that occurs on standing due to a defect in your autonomic nervous system. This is like your body's autopilot, what controls you what you cannot voluntarily control, like your blood pressure or heart rate. So what happens is that when you stand up, a large volume of blood is displaced towards your lower body, and this causes initial low blood pressure when you stand up. So normally your reflexes would kick in and constrict your blood vessels. They would narrow them in order to maintain your blood pressure when standing. But what happens in some people with Parkinson's is that this defect in these nerves produces a lack of norepinephrine, which is the hormone that keeps your blood pressure up, and thus their blood pressure will go down when they stand up. And this will cause the classical symptoms of NOH, such as lightheadedness, dizziness, visual changes, troubles concentrating, or pain in the back of your head and neck, which we usually call coat hanger pain, fatigue, muscle weakness, and ultimately fainting. So now that we know what causes NOH, we know how to address it. And this is by the means of non-pharmacological and pharmacological measures. Non-pharmacological measures focus on maximizing your body's response when you stand up and preventing aggravating factors, while pharmacological try to address your lack of norepinephrine. So we mentioned first that what happens when you stand up is that a large volume of blood starts pooling down in your legs. And the same thing happens in jet fighter pilots when they do high acceleration maneuvers. So in order to prevent fainting, they use these mechanical suits that produce sequential compressions in your legs, in your thighs, and in your lower abdomen. And you can achieve the same effect by using compression garments, by using compression stockings all the way up to the waist, and abdominal binder as well. As you can see, using an abdominal binder can increase your blood pressure enough to reduce or even prevent your symptoms altogether. And even more, you can also help doing this by compressing your own muscles. Immediately after standing up, with this initial dampening in your blood pressure occurs, you can clench your fists, you can clench your muscles in your calves, in your thighs, and your buttocks in order to try to pump that blood back from your extremities, from your arms and legs, and back into your core where you need it, maximizing your blood volume. So another way to maximize your blood volume is by keeping a very good hydration, trying to take at least 3 liters of water a day. Now, it's not only about how much you take, but also how you take it. By taking 500 mLs or 16 ounces of water in one sitting, this can help transiently increase your blood pressure for up to 10 or 30 minutes. And this is a very good way to boost your blood pressure first thing in the morning, even before getting out of bed. Now, another way to help keep that water in is by increasing your sodium intake, by taking about 3 grams of sodium in your diet. Some people take salt tablets, but this usually causes some nausea and some gastric discomfort. So it's advisable to just add salt to your meals or have meals that have a high content of sodium in them. Now, it's also good to try to avoid some beverages that may have a diuretic effect, like caffeine or alcohol, in order to not lose that water. So caffeine may transiently increase your blood pressure, but may also set you back by losing all that water. Same thing goes for alcohol, which is also vasodilator and produces blood pooling. So as you can see, some patients that have low blood pressure on standing, like people with PD, when they take alcohol, the blood pressure goes down even when they're laying down, and much more so when they're standing. So this is a very important thing to keep in mind. Now, it's not only about what you drink, but also what you eat. In meals that have a high glycemic index, that have a lot of sugar, that's absorbed really quickly, like sugar, anything that has sugar in it, white bread, potatoes, white rice, alcoholic beverages as well, like beer. These may cause a reduction in your blood pressure up to 2 hours after having a meal. So we try to favor meals that have a lower glycemic index, like fruits, freshly squeezed juice, nuts, legumes, and even in people that these dietary changes still produces some drop in your blood pressure after eating, you can take a medication called acarbose that helps prevent the absorption of glucose and prevents that your blood pressure drops so much after eating. Now, one thing that's very important in people with Parkinson's, in terms of mobility and NOH, is physical conditioning, trying to avoid physical deconditioning. It's really easy to fall into these vicious cycles in which you have symptoms when you stand up, so you become sedentary, you start avoiding physical activity. This in turn will start decondition your muscles and your heart, and next time you stand up, your blood pressure will fall down even further, you'll have more symptoms, and you will keep feeding into the cycle. So what we recommend is for you to do exercise in a recumbent position, so you can avoid the symptoms and you can avoid the risk for falling. So you can do this by using a recumbent bicycle or a pedal exercises. You can use a rowing machine, or you can do exercises in the water, like swimming or doing water aerobics. Now, this is very good also because the water pressure around you will help sustain your blood pressure by preventing the pooling. Now, even with all of these measures into account, you may still need some medications to help support your blood pressure. So these medications will, like we said, address the lack of norepinephrine. We have droxidopa, which is an amino acid that turns into norepinephrine directly. We have midodrine, that's a synthetic analog of norepinephrine. And we have fludrocortisone, which is a steroid that enhances the activity of your norepinephrine receptor and also helps retain salt and water. There's also investigational products such as ampreloxetine or atomoxetine that help inhibit the reuptake of norepinephrine. It makes the norepinephrine last longer in your blood vessel. It enhances the natural activity of your norepinephrine. Now, you also have to be aware of certain medications that you may lower your blood pressure, like tamsulosin for benign prostatic hypertrophy. It does the exact same opposite. It blocks the effect of norepinephrine. There's also sildenafil and tadalafil for erectile dysfunction or for pulmonary hypertension that cause vasodilation and blood pooling. And many antidepressants have some effects that may also lower your blood pressure as well. Moreover, certain medications for Parkinson's, such as levodopa or dopaminergic agonists, may also cause hypertension. And in these cases, it's better to try to favor those medications that have an extended release, so it's less likely that you'll have side effects from them. Finally, many people with NOH may also have the opposite effect, may have supine hypertension, high blood pressure when laying down. And paradoxically, this can worsen your hypertension because when you're laying flat at night, your blood pressure is high, your body will try to reduce that blood pressure by creating diuresis, by going to the bathroom. We'll wake up more often at night to go to the bathroom, you will get more dehydrated, and you will wake up with worse symptoms of orthostatic hypertension in the morning. And this can be taken care of quite simply by elevating the head of your bed, just enough so that your blood pressure is at normal values. You have to make sure of this, and you have to make sure that you don't slide down your bed so that you don't end up flat in the middle of the night and void this whole purpose. In some patients in which they have very high blood pressure and this isn't enough, your doctor may use a short-acting antihypertensive to lower your blood pressure. But you have to be very careful because this will also lower your blood pressure when standing at night. And if you wake up in the middle of the night to go to the bathroom, you may have increased risk for falling. So the key takeaway points from this talk is that it's not all about the pills. There's plenty that you can do yourself to prevent or improve your symptoms of NOH, that you also have to be aware of the supine hypertension and overnight dehydration. And there are plenty of medications that can help you with your symptoms, but there may be some that may worsen them as well. So this is all for today. I thank you very much for your attention, and I very much look forward to your questions.